I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to call the Lamar City Council regular meeting for Tuesday, November 5th, 2024 to order. Roll call, please.
Goodchild,
Yes.
Wick,
Yes.
Sturgeon,
Here.
Bruns,
Here.
Hick.
Here. Motion to approve the agenda? Second. I have a motion and a second. All those in favor say aye. Aye. Opposed? Motion carried. First thing on the agenda is citizens. Any citizens here to address the council? Kind of?
Kind of, yes, kind of. Want to give you guys a update on a couple things. Lead and copper, there's a bunch of letters going out for lead and copper inventory. We have to send out letters for lead service lines, galvanized required replacement, and then unknowns. We have 1,500 of those we had to send out just yesterday and today. So if you guys have any questions, it's an EPA requirement, and most of them are for people who didn't respond. And the EPA requires us to keep sending letters out every year until they do respond. So you might be getting some questions about that. And in the letter it does state what is effective lead lines and that kind of stuff. It is still the citizens' choice if they want to replace them or not. We do put orthophosphate in the water to help prevent anything like that would happen in Michigan. So our water is safe, even if they have a lead service line. We have to take precautions for years. It's something they require us to do. So we're still doing exactly the same thing. So we'll let you know about that. And then also we did do 2 tests of PFAS because since we became over 10,000 people, the EPA requires us to do some extra testing in that, and we have no PFAS in our water. So just so you guys know that.
Thanks. Thank you. Any other citizens? Another citizen?
Citizen and worker, and yeah. A couple weeks ago we had a gas leak downtown. I just want to say thanks to the businesses that listened to what we needed them to do. Mid-American's quick response. And then of course our business people, our volunteers go to calls and help us out. It was a very dangerous situation that we mediated very quickly. Considering the circumstances, we had to evacuate a few buildings and things, but everything went well, and so thanks to everybody that just cooperates when we need it, so thank you.
Any other citizens here to discuss? All right, thumbs up or we'll start with you, Brad.
Well, as it is election day, thanks to everyone who voted, regardless of who you voted for. And thanks for all of the folks who are running for office. It's not necessarily an easy job, but thanks to all of those folks, and thumbs up to you all.
All right. Brian.
Pass.
Mark.
Specialized concrete. I really like what they've done with the old Walmart. They have really made that look nice out there with just grass.
Might be the best lawn in town.
Yeah, I think that's probably.
Do we have an award?
I know it puts our police grass to shame. They need a better quality of grass at the police station.
Yeah.
No, it looks great. It looks really good.
Yeah, I concur. I got several, only because I missed the last meeting, but maybe it was mentioned at the last meeting, but thumbs up to Mark Gall and his group that completed our community plan. That plan received an award from the American Planning Association Iowa chapter for best community plan at their last banquet. So that was pretty cool. And also on the anniversary, I think roughly, of Erdmanville, we've turned that over to new owners now, and we'll see construction start very soon. So just right at a year's time of owning it, and turn that around into a viable project for us. So, and then I was going to give a thumbs up to our fire department for the gas leak, handling that. No, for handling it and also the harvest season. It was a very dangerous harvest season, I thought. Extremely dry and windy, and lots of crop out there. So thank you for all that you do during that time. I'm sure it was a very busy year for you. And then last, I am attending, per the recommendation of my friend Mark here, the Citizens Police Academy. And so I want to give a thumbs up to our police chief and assistant chief for the work that they do for that. It's been very eye-opening, all the stuff that they're involved in, but probably the coolest thing that I really had no idea was how closely they collaborate with our county. The county sheriff's deputies are finishing the sentences basically of our police force. I mean, it's that close of a relationship, and very cool, and I think our city is all the better for it. So it's a great deal. So
thumbs up to Lori and her crew at the chamber for all of the Halloween activities and planning and all of that, and the downtown businesses. Total Motors for the pumpkin races and all of that. That was very cool. Got a lot of kids downtown. It was well attended and all of that. And then thumbs up to our street departments and park departments for making the transition. Let's make us look a lot more like Christmas quickly. I'm a big Thanksgiving fan, but it's beginning to make the turn. So thumbs up to them.
Mark?
Also a thumbs up to the people working at the polls.
Yeah.
And putting in a long day to make sure that the election happens well. Thumbs up to the contractor on the southern part of the Plywood Trail who is really making some neat improvements down there. If you look from Leeds all the way up past C80, that's day and night. It's nice. So I don't always want to complain when it isn't good.
Very good. Okay. Moving on to consent items. Under consent items, we have an approval for the October 15, 2024 regular meeting minutes, a list of bills for period ending 10/31/24, appointment to Civil Service Commission, a new 5-day liquor license to Bachers, urban revitalization tax exemption requests, and police department requests hiring list.
Kevin, you want to do a little explanation on the hiring list, please?
Council, Chief Vandevek. The reason for the request is in part kind of follow up with what we did this past fall with a hiring and recruitment tool, not just in our department, but across the state. This past April, the governor did sign a provision under the civil service statute that allows cities to suspend a very small portion of civil service to assist cities in more effectively hiring people. So in essence, what we are doing is we are no longer requiring civil service to certify a one-year list. Moving forward, we are going to have a non-expiring list. At any time, anybody can apply for a position on our department. We may not have an opening, but they could always have an application on file. The part of that that's a little bit different is they will only remain on our list for 1 year. So they can keep dropping off throughout the year.
Okay, that would answer my second question, was if they're on there forever until...
No, they're not.
Okay, gotcha. Okay,
No.
that's fine. In case something, an individual changed in that.
Yeah, things could change. The part of that is critical is they can only remain on a hiring list for a period of 365 days upon the completion of a written examination. So once their written exam is 1 year old, they would fall off the list. Our plan is to contact them about 30 days prior, just to ask if they would like to retake the written exam.
So this will expedite, you don't have to wait for an opening and all that, right?
We don't have to advertise necessarily anymore. We'll have a non-expiring list at any time that we do have an opening.
Okay.
We may have candidates that could fill the position immediately.
All right, thank you.
And this will come before the council every year. They'll have to suspend it every year.
Oh, I see.
So this will be if it goes well, this will be a consent item next year around this time.
It
as well.
renews
Right.
each time, okay.
Right.
Okay, thank you, Mike.
Thank you.
Motion to accept consent items 1 through 6.
Second.
I have a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed? Motion carried. Moving on to action items. Action D1, Floyd Valley Healthcare Audit Report. Floyd Valley Healthcare staff will be at the council meeting to answer questions regarding the Floyd Valley Healthcare Audit Report for the year ending June 30, 2024. I assume that's this large packet that we have in front of us. Daryl?
Thank you. Good afternoon. Daryl Friedenbach with Finance at Floyd Valley Healthcare. Customary this time of year, we bring the hospital audit report to the council for your information. It's after it's been presented to the hospital board of trustees and approved by them. So the hospital board, Denman and company, had completed the audit and presented that to the hospital board at the October 15th meeting, and they approved it. As is customary, or your goal anyway, with any audit report, is that you hope that it's a clean audit report with no concerns, and that was the case. So got a clean bill of health from Denman and company on the hospital audit. So those are very thick audit reports. Obviously, you see it, there's a lot of pages. I'll just spend a couple of minutes hitting just a couple of high points in the financials, and of course, if you have any questions, you can let me know. We had a very successful year. Again, last year was a good year for us in ending 2024. We continue to invest in facilities and equipment and staff, and last year was certainly no exception. When you look at, we're at $90 million worth of assets currently, getting to be a very large organization. 36 million of that is invested in facilities and equipment. Of that 90 million, the remainder is in patient accounts receivable, cash, and short-term investments. So very strong that way. Total long-term debt of a little over $27 million on there on the balance sheet. We've got very favorable terms on our debt. We've been very fortunate that was debt issued over the last number of years for facility expansion, and those are all again, favorable terms. Because we are a strong organization, we've got strong operating returns. We've got plenty of resources, don't anticipate any issues with meeting those debt obligations, remain very strong. And in fact, if you look at our net position, that assets minus our long-term debt and accounts payable, we've got a net of about $44 million as of June 30th. If you look back, even 2 years ago, that was at 34 million. So just in the last 2 years, we've, increased our net position by $10 million. So as we continue to expand and invest in facilities and equipment, we still remain, and we've grown to be stronger yet. So doing very well there. When you look at fiscal year 24, total revenues, just over $57 million in total revenues. That was about a 14% increase over the prior year. Almost all of our revenues come from outpatient services. There's some inpatient, but overwhelmingly it's outpatient services, and those continue to grow and expand as we've expanded our facility and continue to offer new services. So pleased to see that growth. When you look at our expenses for the year, at about $52 million worth of expenses. Over half of those expenses are to pay the salaries and benefits of our 350 employees we've got in 24 that we paid. So, again, those are folks that live in our community and surrounding communities, and are an important part of what we do at Floyd Valley. You take those revenues minus the expenses, we had a total margin of about 5.2 million. So again, very solid year. Last year was a solid year, kind of stacking them together here. I think the message is we feel like we're well positioned for the future. We've got a lot of things we're working on, but I think we're in a strong position. Look forward to the continued growth of Floyd Valley and the community. And I think we're well in tune to that. So with that, I'll end. And if you've got any questions, I'm happy to answer. Dustin's here as well. If you got anything about what's happening at Floyd Valley, we're happy to answer.
How's the Park Place whole transition deal going? I am kind of curious about that.
Yeah, Dustin, do you have any comments you'd like to make?
Yeah, thanks, Clark. We've been really happy with that. The idea when we brought all that forward was that family members would not feel that transition. I think we've been really successful there. Akira's been really happy with it as well.
Are they put in their kitchen yet?
They have not started that yet, but we do have a meeting upcoming to talk further about that. So all the meals are still being cooked and brought over from Floyd Valley, just like they were when we owned Park Place.
Okay, sure. Thank you.
What are the number one or two challenges that you guys see for Floyd Valley? going forward?
Yeah, I would say, thanks, Rob. Great question. Not similar, or I guess different from what you'd see across the state. Staffing across all positions in healthcare still remain a challenge. We've been able to weather that storm fairly successfully. We are working across the state within Iowa Hospital Association and locally, just trying to build that pipeline up, especially across the clinical areas that we staff. And that's going to be a challenge into the future, but again, I think we're well positioned to meet that. Physician recruitment, we've been fortunate on that front. One of the good things that's come from our investments in the facilities, when we have providers that are touring in our campus, they see continued growth, and that's a positive. There's a lot of rural communities that can't offer that type of visit that we do. And so as we build that medical staff, we feel like we're going to be positioned well to continue to bring new physicians into the community. And we've been fortunate in that. We're going to have a number of retirements coming up over the next 3 to 5 years, so we're actively recruiting to meet that gap. But so far, we've been pretty fortunate to get some physicians in the community that, one, are tied into Floyd Valley, but are also committed to the community. And obviously, that's a great win for all of us.
How's your 75 project coming? ETA on that, or?
Yep, so we just had our first construction meeting today, and the contracts are out, and our completion date will be May 31st, but I think we'll be ahead of that, Clark.
Is that shell, or is that complete?
Complete. I think we'll be moved in before May 31st, but that is the timeline on it, and I think we're going to be on really good track for that.
Okay.
Is that additional staff, or is that just shifting staff from here?
Yep, they'll be shifting staff. Our urgent care team will come over, and then our home health team will come over as well. And again, that will decant some of the space on the main campus for us to continue our growth services there.
Thanks.
Yep.
Pharmacy going well?
Pharmacy's going, yeah, no, great questions. Pharmacy's going really well. Good opportunity to talk about it. No, our retail pharmacy's now open. That's been open about a month now, and we've been really happy with it. And the whole objective there was to have on-site services to ensure from a community and patient perspective that it was convenient as possible, and I think we definitely have met that need. There's a lot of funding sources within CMS, things that we get measured on our inpatient side within the hospital. So now we have our pharmacists, both the hospital employed and retail pharmacy can now be on the floor. That prescription is delivered while they're still in the hospital before discharge, going over those medications. And so we know as patients, as they're discharged, medication adherence goes up significantly, and they actually understand what they're taking versus leaving the hospital, talking to our care team, going to get the prescription filled, and then trying to navigate all that. All that happens in one consult now, and it's gone over really well. We've had good feedback on that.
Very good.
I apologize for this confusion over here a little bit. I made a request for somebody to be on the phone for later.
Sure.
I didn't want you guys thinking we were talking about me. No, not at all, but I apologize for that. Thank you.
Yep, thank you. Great questions.
Thank you. Every time I'm out there, unfortunately, it's mostly for meetings, not visits. It's impressive to see the change, and yeah, it's very neat.
And I just want to conclude by saying thank you to the council and everyone within the city. That partnership for us is so instrumental, and I think as we grow as an organization, obviously 100% of our purpose is make sure we're providing high quality care that's convenient, close to home, and we want to make sure that we're doing that in conjunction with the plans of the city. So thank you for the ongoing support.
Okay. Thanks, Daryl and Dustin, and thanks for what you do. I would accept a motion to accept the audit report.
Motion to accept the Floyd Valley Healthcare Audit Report for the year ending June 30, 2024.
Jump the gun. Second.
We have a motion and a second. Any further discussion? All those in favor say aye.
Aye.
Opposed? Motion carried.
Can we move to 5?
Yeah, move on.
Okay.
Move 5.
All right, we'll move to item D5, the anaerobic wastewater pretreatment system design. Attached is an engineering services agreement with Evoqua for design engineering work for the anaerobic wastewater pretreatment system. Evoqua will develop the model for the pretreatment system, which will be used by Bolton & Mink to develop the mechanical package used for construction. Administration recommends council approval of the agreement. The $393,000 cost will be shared between the City of Lamar's, Wells, and Kemp's.
Greg Sint from Bolton Mink is on the phone if you have questions.
Hi, Greg, are you there?
I'm here, everybody, yeah.
Hey, this is Clark.
Yeah.
This is Clark. Greg, this caught me a little bit by surprise because 2 weeks ago on October 15th, we approved a contract with you for $3,300,000 for engineering and design. And then we get another $400,000 engineering contract that seems to be subbed out. And that would be an additional to the $3,300,000 one. I guess it was my understanding that you were the design. And so I'm a little bit caught off guard on this.
$3 million contract you're referring to is the Phase 3 project. That's the big combined plant, residential, commercial, and industrial plant. This ADI design is for the Phase 2. That's the industrial pretreatment facility. And that's a proprietary process design that the provider of the process charges a design fee for developing the design details. They'll be, we've been working with them for the last year or so in developing this concept, and this is their fee for producing the detailed documents for them to build the facility. Actually, they'll provide the information to us, and we put it into our bid documents. We take their concepts, put it into our CAD format, and there's other pieces that go with it for the total pretreatment facility. This, what ADI Evoqua is providing, is the anaerobic process. That's the covered anaerobic basin with the recirculation system and heat exchangers and biogas system.